Conversation with Dr. DeRosa brought to you by Marcus and Mack, a law firm representing injured people. So here she is. She's Dr. Julie Kang DeRosa, the newest physician at the IRMC Physician Group. Welcome to Indiana County.
Thank you. Glad to be here.
You've been here for how long? About a month now?
So I moved September 18th, and I started working October 1st.
Mm-hmm. All right. So, and you're working out in Marion Center?
That's right. That's right. So I'm helping out through the end of the year, seeing patients 1 day a week at our primary care center in the Overlook building by the hospital.
Mm-hmm. Oh, okay. All right. So you're there as well.
Just till the end of the year.
So let's learn about Dr. DeRosa today. You're from Western Pennsylvania, are you not?
No, I'm originally from southern West Virginia, but I haven't lived there for many years.
Uh-huh.
So my first foray into Western Pennsylvania was my residency in Beaver,
mm-hmm.
And then I went away and did a fellowship in Tennessee, and then returned to Washington, and I have been in Washington since 1996.
Okay, so now you're here. What's it been like for you? What's it been like for you in this short time here in Indiana? You like it?
I do. People are so friendly, and I really do feel that God has placed me in this community to serve the community.
Oh, wonderful, wonderful. Primary care, yes?
Mm-hmm. Yes, family practice.
All right, so tell me about it, because this is something that I think we don't emphasize enough, the need for someone to have a family practice medicine operator or practitioner, and of course, primary care physician. That's where it all starts for people when it comes to their health.
Yes, and I completely buy into the concept of having one-stop shopping, because even if you do need specialty care, it is so helpful to have someone managing it all, a repository for all the data, and somebody to communicate with the specialist. And I've learned that very clearly with my son, who is on the autism spectrum and has needed a lot of specialty care throughout his life.
Mm-hmm.
And it's been really helpful for me for his PCP to have the information so that when he needs a new specialist, they can go to the PCP to get the information.
Yeah, that foundational stuff is very, very important. So let's talk about some of the basics for someone getting involved with a family practitioner. You're looking at physicals. You're looking at I know it's different for ages and sexes and the various different factors that go into healthcare, but there are some foundational things that people need to know about the reason for having a family care physician.
Yes. So, in fact, in just the short time that I've been here, I have seen several patients who had an urgent need for a primary care doctor, either needing medical clearance for an urgent surgery, needing forms completed, and they didn't have a PCP. And fortunately, we were able to get them in a timely fashion because I'm new and I'm building my practice. But that guarantee isn't always there, and you just never know what will come up. And then the preventive measures, prevention is just so much better than treatment. So it's better to nip something in the bud in the early stages or prevent it altogether, and that's where the primary care doc comes in.
Boy, haven't we learned that this year? My goodness gracious! With of course the pandemic, it makes things like getting a flu shot so very, very important, doesn't it?
Yes, I am a big fan. So my children and I have all had our flu shots, and doesn't guarantee that we won't get sick. But even if you do catch the flu, you're likely to have a less severe case of it. And then, of course, what we call herd immunity, where when a large number of the population is immune, that helps to protect the people who are not immune, the people who don't get the shots. So it's so important, and they're so available. And many pharmacies, like Giant Eagle for one, will often they'll give you a $10 gift card, or they'll give you fuel perks if you get a flu shot.
We're talking with Dr. Julie Kang DeRosa, who is the newest doc with the IRMC Physician Group, sort of a Meet the Doc segment here on Indiana in the Morning. We had heard earlier this year that with the pandemic, a lot of people were delaying some of the things that they might normally get done in terms of their health care, their annual checkups, mammograms, all of the different things that you want to be right on top of. And I know that you would very much support the fact that you cannot do that. You have to keep up to date on your health, especially now.
Yes, exactly, because there are no guarantees that the services will be available. Sometimes, like during the height of COVID, out of necessity, facilities were shut down and not doing mammography or endoscopies. And so you want to get it done now while you know that they're available.
Yes, absolutely. And so you're thinking of the routine screenings, the blood work that you get done. I mentioned mammograms, prostate screenings, all those different things that you are available to you now so that you can catch things early.
That's right. That's right.
Yeah.
Yeah. Now, I will say that prostate cancer screening with the PSA is not a strong recommendation. So, in terms of preventive care, there's a pretty rigorous process in vetting the interventions, and so the benefit has to clearly outweigh the risk.
Mm-hmm.
And prostate cancer screening with PSA is one where the benefit does not clearly outweigh the risk for the average man.
Mm-hmm.
So it comes down to an individual decision on that particular one. So it's not that it's of no value. And certainly if I have a patient who would like a PSA, I'm happy to order it. But I do counsel them. That the benefits are less clear compared to mammography and colon cancer screening.
Yeah, well, it is Movember, and so men's health becomes a focus. Just having come out of Breast Cancer Awareness Month, we move into Movember. So prostate cancer, testicular cancer, other men's health issues, and things that aren't necessarily limited to men, but men seem to be more prone to it. Suicide is one of those things. All of those can be, the PCP can be a part of that whole formula for treatment and care.
Yes, and actually this was an educational experience for me. I hadn't heard of Movember, but in preparing for this interview, our PR person had mentioned Movember, so I looked it up, and wow, what a great movement! I wasn't aware of the high suicide rate. The Movember website cited 60 men per hour worldwide who commit suicide, and so wow, that was very sobering. And one of the many important services that primary care docs do is screening for depression. That is a required tool, and I have been so thankful for the many times that I had a patient in for routine care, and because we screened, we detected depression and got the person on treatment and greatly improved their quality of life.
Yeah, it's such an important part of that whole mix, and as I called it a formula for care, and the PCP is a key part of that entire formula. So you're working with Dr. Parks as well at the Mahoning Medical Center. I feel for you in that because
I'll tell him you said that.
He expects me to say things like that. You just tell him it was me who said it, and he'll understand.
Okay.
We've been talking this morning with Dr. Julie Kang DeRosa, If you would like to become a patient of hers, you may call the IRMC Physician Group 888-452-4762. You're living in Indiana right now, right?
Yes.
Yeah, it's such a
Yeah,
nice...
so we have an apartment for now, and then we'll look for a home to buy in the spring.
There you go. You'll enjoy it. It's such a pretty community. And we appreciate the fact that you've been able to come and spend some time with us here this morning, if only by phone. But it's been good to catch up with you and to learn about you.
Well, thank you for having me.
Thanks for coming on. We'll talk with you again, I'm sure.
All right.
Have a great day.
Have a good one.
Bye-bye.
Bye-bye.
It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160.